Wow, what a welcome. I feel like this is a school reunion, but I've never met you all, but I know you all. Do you know what I mean? And I apologise if you can't understand my accent. You'll just have to decipher it. And yeah, we'll work with it. So it's such a privilege to be here and to spend this time with a whole bunch of people that I interact with a lot online, and to have the conversations that we've maybe started off online come into real life, and then to carry those conversations on. So if you're not on social media, it's time you were, okay? Because we talk about this stuff. And that's why I'm really excited to be here, because as a group, I think we're developing this community of practice that says the disciplines that we come from matter a whole lot less than how we are with people. And that's why I'm not a psychologist, but I use a lot of psychological techniques. And I don't think we're stepping out of scope when we start to talk about what matters to you. How can I help you live better? So, without further ado, being like water. And I'm going to try and get used to this. Is that making a lot of noise? It is. Okay. Sorry about this. It's my jewellery and stuff. I may just hold on to it. So we'll try this. So, being like water. Welcome. What I hope this session will be about is getting from maybe to yes without tears. I know that there are times we ask people to do things that you kind of hope they're going to do in their own home, but you've got no idea whether they really do. And they give you that sort of look that, okay. So there's a lot of ways that people show resistance to our suggestions about home exercise programs, about maybe breathing exercises, about trying difficult things in their own environment. So I've called this critical skills for interacting with clients, patients, colleagues, friends. I should have added children, partners, dogs, cats never, it never works. And yeah, there's a nod or two to Bruce Lee. Some of you will know this material really well. Use that knowledge wisely in this session. So I'm going to preface this with a lovely quote. He's actually a philosopher. I think this is amazing. He says, adapt what is useful, reject what is useless in your context. I've added those bits. And then add what is specifically your own. This is a beautiful part of New Zealand. I take a lot of photographs, so this is a beautiful part of the Buller River, which is a really large lake that has an awful lot, or large river, which has an awful lot of sandflies. And I am a sandfly and mosquito magnet. So that was a very quick photo. So what I hope to cover today are some concepts of motivational interviewing. I'm not teaching motivational interviewing. I just want to have some ideas about the ways that we can be with our clients. I hope we'll have a chance to practice and play with some of these ideas. Oh, I had fun with the animations. I hope that we can troubleshoot and think about some of the things that might get in the way of us doing this stuff and integrating it with our practice, and identify some obstacles, particularly to how am I, you, going to do this. So we'll have an exercise at the end that we may not get time to finish here, but we will. I'm hoping you'll take the handout away and be able to work on that in your break. I want to look at making action plans. That's the action plan. And some take-home prompts. So you'll find a 3-page handout there that has some prompts that you might want to try using. There is nothing wrong with using a cheat sheet. When I started using these techniques in my practice, I had a cheat sheet, and I had it sitting in front of me so that I wasn't going that possum in the headlights look. I don't know what to say. So I've put that in there for you. So, how about it? You want to be like Bruce Lee? Yeah. So the spirit of motivational interviewing is far more important really than the techniques. The spirit is really embodied in the statement about being flexible, about not pushing, not saying you must, but finding wiggle room in the way that we do things. It's about partnership, knowing that the person that we're working with is the best judge of what is going to work in their lives. About acceptance, that I'm here to help you, not I'm here to make you do what I want you to do. About compassion. This little prayer, I suppose, was written by Bill Miller, who's one of the developers of MI. Guide me to be a patient companion, to listen with a heart as open as the sky. Isn't that lovely? And how to evoke motivation from people. What were you hoping for by coming to see me? So it's not about me, it's about the person. So here's a moment. How were you taught to educate patients? Were you taught to tell, do, prescribe, assess, judge, be the expert? Or to guide, to allow, to foster, to collaborate, to be equal partners? Think about that. Because when I was trained, when in doubt, shout louder. Because we're the experts, they came to us. If only they do what we know is good for them. Yeah? But what we run into is called the writing reflex. And we all do it when we're told what you should be doing is more exercise, less alcohol. Yeah, less alcohol. Better eating. We push back. We don't like being told what to do. Our patients like it just as much as we like it, which is not a lot. And I love this. He that complies against his will, you can add the feminine in there as well, is of the same opinion still. So people, us, will do things because other people want us to, but actually deep down inside, we might not be convinced. And we'll just go on our merry way thinking, oh, yeah, all right, okay. And so some of the messages that we've heard over the last 2 days can be a bit thought-provoking, and we might think, oh yeah, okay. Is acceptance the way to go for pain management? And some of us will say, oh yeah, right, okay. I'll go along with it, but I'm not sure, actually. So let's have a look at our patients. There are some concepts and ideas. I'm going to run through this fairly quickly with MI. The first is that Miller was a very good observationist. What he did was he saw, and he's the developer of motivational interviewing, he was watching people who were required to attend for alcohol counselling, and he was watching what worked. And what he saw was different responses depending on the style of the person carrying out the therapy. What he found was that those that evoked the person's own motivation and empathised instead of pushing back managed to get better outcomes than the ones that said, you've got to. You know, you realise you'll end up in jail if you don't start drinking less. And he developed this really on 3 concepts. And I'm taking this mainly from a paper that Miller wrote in the 90s. Sorry, I don't have the reference on the slide. I deleted it. I've gone through this presentation a few times. Slides fall off. So cognitive dissonance is that we have an inner drive to hold all of our attitudes and beliefs in harmony. And so when we're given something that contradicts with what we believe, we have this dissonance. We just don't feel quite right. So when someone tells us to do something we don't really want to, we fight back. But then we also know that self-perception, when I say things, we like to behave according to the things that we say. And he also drew from Rogerian therapy, which is this interpersonal warmth, that being a nice, warm, listening, supportive person is really influential in terms of how well people will go along with what we say. And what he found by observing these people that were doing this kind of therapy were two important processes. One was technical, we'll talk a little bit about that, and the other is relational. So the technical processes were reinforce the kinds of sayings, the things that people were saying that you want more of. So yes, well that sounds great. And empathise when you hit resistance. When somebody rolls their eyes, when somebody says yes, all right, but. Anyone had yes, but clients? Yeah? Yeah, I have too. So those were two technical processes that he analysed. And then there were these relational processes about being empathic. How do you demonstrate empathy? And how do you demonstrate this positive regard that you're actually okay, person sitting in the other seat. You are not a pain patient, you're actually a person. And I think you're amazing. And when he looked at the technical processes, what he discovered, and I won't point arrows, was that therapist empathy and spirit, combined with using these particular techniques of reinforcing talk that was along the lines of the direction that you want to go, and empathising that resistance, increased change talk, the person's utterances saying, I'll do this, I might try this is a day, I'll try it, and reduced the occurrence of resistance. And these led to two pathways. One was a greater commitment to changing, maybe a time and a place, and the actual occurrence of making changes. That's pretty cool. What I liked about this was observing people, therapists, doing therapy. So it came from observation, and I'm very keen on that because as clinicians, we sometimes forget that what we observe and what we do might be unique and worth following up in terms of research. And I was looking at Paul's session yesterday morning on clinicians' creativity and looking at the ways that we all use images and pictures as metaphors. And wouldn't it be cool if we shared some of that stuff and started to understand what it was about those that helped people to make changes? So that's the processes. And then he tried to understand what does that look like? And it really looks like trying to understand where is this person coming from? I have this theory that people don't get up in the morning and decide to do dumb things. They're actually trying to make the best decisions they can with the information that they have in that context. Some people do dumb things, but maybe it's unintended consequences. And he also discovered that it was about evoking what is this person most concerned about? What is it about this situation that people are most concerned about? And I really love Kevin's work on what people really want from coming to pain management. And very often it's not reducing the pain. It's, I want my life back. I want to do the things that I want to be able to do. So, what are the client's own concerns? And then he looked at these relational principles about being collaborative. We're not one up with the client one down. We're actually at the same point because we're trying to discover together what might work for this person in their context. We don't push. We like to let people's autonomy and values be the guide of the directions that we might take. So what does that look like? Let's take some time to understand where that person's coming from. How did they get to the point where they're doing nothing every day? Why are they basing their decisions on, or how is it that they've based their decisions on things that will lead them to, I just can't do these things anymore? If we can elicit those sorts of desires, the things they long for and dream for, then we're able to work with that to help them take a step closer towards the life that they want to be able to live. And then we can use that spirit of, I'm your partner, rather than I'm your boss. So, here's a checkpoint. Food for your thought. How would you like to be viewed by your clients? So what I'd like you to do is, in your little groups, just gather together, 2s and 3s, and just describe what kind of practitioner you are. What makes your work special? We've only got 2 minutes for this, so go for it. And what does that look like? I want to see what your operational idea of being this kind of professional is. Okay, go for it. There's a good buzz of voices here. And if you can, just reflect on why you want to be viewed this way. What values does that embody to you? Okay, sorry to wrap this up short, but we don't have a lot of time and I tend to gab on a wee bit. So just hold those thoughts about the kind of therapist you want to be and why that might be important and what you're doing at the moment to help you be that kind of person. And once again, the philosopher says flow in the living moment, open yourself and flow. Flow in the total openness of the living moment. If nothing within you stays rigid, outward things will disclose themselves. I like that. Moving, be like water. Still, be like a mirror. Respond like an echo. And what we're doing when we're talking with clients, I would hope, is to be able to be like water. Can we hear them? Rather than trying to bludgeon our way through to get people to do what we want them to do. But wait, there's more, because I'm the therapist, yeah? And I found this and I thought this was great. Unsolicited advice is the junk mail of life. Have you ever been told what you should be doing? Oh yes, we have. So that's where we come from. And we need to remember that, just as we remember that our clients come from the position they come from with the best of intentions. They don't deliberately do dumb stuff. We don't deliberately do dumb stuff. But sometimes we come with an idea that perhaps has outlasted its usefulness. So, there are 4 processes that I want to quickly talk to. The first one is when we're engaging with a client. How often do you start with asking, what do you want from me? What's your theory about your pain? Or do we install pain education like a piece of software? Let's just plunk it in and hope that it fits. We could say we can talk about this, this and this, and then ask, so what's the most important thing for you? And then we should tell me more, sorry. I get carried away. We want to understand more. I'm not singing, I promise. The reason I say this is because often we call this the subjective, and it's almost dismissed. It's not actual real information, it's the subjective assessment. I wonder if it might not be the most important part of what we do when we're with a person. The second part that we can do when we're starting to look at, we've broadened out, what is this person really interested in? What do they understand? Is starting to focus. What is your main concern? What are you most bothered about? And as we saw with Kevin's information, it's not necessarily the pain. It might be life. Which is the most important thing for you? How can I help you? What would be the most useful thing we can do today? And you may find that for this person, sitting and having a talk about their pain might be more handy for them and more important than putting your hands on them. At the same time, we can talk while we do things. So it's quite common for me to go for a walk with my client, go and get a coffee, and while we're doing that, we're talking and we're doing pain education. I hate that term. We're talking about pain. So when we're focusing, we can find out what is that person's main concern. And once again, we're going to say, tell me more, tell me more. Every time they say something, tell me more. What is it about that that's important for you? What would it be like if that was not such a problem for you? As we're doing that, aren't these pictures glorious? Oh, these are not mine, these are off the interwebs. And yes, they're Creative Commons, I'm allowed to use them. Then what we might need to think about doing is how can we evoke, how can we elicit the things that will begin this person to change? How can we give people the idea that any change, even a little piece of change, is a start? Rather than, oh, I'm not satisfied, you're not going to do all of these things, you just want to pick on this one thing. But just helping people resolve their ambivalence. Most people do know, like we know, that we should eat more healthily, drink less alcohol, do more exercise, perhaps relax a little more, and we don't get around to it. Yeah? We're ambivalent about it because it's hard to make change. So one of the things that we can help people do is to resolve their ambivalence. Let's have a look at the good things about status quo and the not so good things about status quo. And how can we work through that? And at the end of this talk, I'll be showing you a method that might be useful. And you know, once again, tell me more, because we want to understand where this person comes from. And then, and only then, we can spend some time planning. Because we need to invest a little bit more time in understanding where this person comes from before we start developing this treatment plan that's going to do wonders. Otherwise, we could be building a building that's the wrong shape, that's the wrong style, that's in the wrong place, and it's for the wrong purpose. So what are the person's next best steps? Maybe they have some ideas about the kinds of things they might like to be able to do next. Like us, they've probably been told you need to do some exercise. And they've probably got some ideas about what they like to do. And given, especially in the case of low back pain, we don't know any particular form of exercise that is any better than any other. Why can't that person go gardening, swimming, belly dance? That's mine. I'm not doing any demos, but you know. Why can't they do the things that they love to do as part of their home exercise program? And why not call it, let's go for a walk, then you must do your home exercise program, which immediately conjures up ideas of sweat, lycra, and you know what I mean. Are you willing to take this? Would it be the next best step for you? So it's a very gentle way of suggesting and working with the person and beginning with their ideas. And we might think, they're outrageous, they can't possibly do this. It's too advanced. But people might surprise you. And so what if it's too advanced? If they try it and it doesn't work, you've got something to learn from. They've got something to learn from. And your job is to be there. And yes, you knew it. Tell me more. We want to understand more. We can never learn too much about some other person that we're working with. But timing is everything. So drawing from some of my research, when pain starts, for a long time people are just trying to make sense. And they often see a clinician at this time who's attempting to return to normal, a normal me, which is great. But as pain persists, people often want to gain some more diagnostic clarity. So what is this thing I've got? What's the name of it? So I can go and Dr. Google it. And yeah, probably get a whole bunch of stuff that doesn't make any sense, but it might be useful. They want to understand the pattern and shape of symptoms. What sets my pain off? What settles it down? What can I expect to be able to do on a bad day as pain persists? And most people during this phase are just getting by, just hanging on in there. At some point, some people, and we can facilitate this, get to this point about deciding, well, yeah, this is where I'm at, this is the way it is, life's too short. And these are the people that I studied in my work, which was looking at people who cope well with their pain. They decided that actually life is too short. There are things I really want to be able to do. I want to be a good mum. I want to be able to play rugby. In case of one of my New Zealanders, we like rugby. I don't, but never mind. There you go. So our job as clinicians is to facilitate that willingness to have a go, to attempt, to try, and to do things that fit and align with what the person really values. And then people can flip into this longer term process that I've called flexibly persisting, which is kind of like water. It goes in the direction it wants to go, but it doesn't necessarily go in a straight line. You ever watched a river? Looked at a river? Where people are doing values-based action, things that align with a life that's in the direction that I want to go to. They learn coping, and coping becomes relevant and real, and they begin to plan for the future. That's exciting. Most of the people we see are not in that phase. They're in that, I don't know what this thing is I've got no clues about my normal, where do I go to from here? So maybe our job in that time, we're seeing them as helping people actually understand the shape and the form of their pain and what might happen and what it might be like and what sets it off and what settles it down, and just hold on to daily life as it is. So sometimes we have to temper our approach depending on where this person might be at in their process of coming to terms with living with maybe a long-standing pain problem. So there are 4 key skills to learn. We don't have a lot of time to do this, but I'm just going to very quickly run through this. The first is to learn how to ask open questions. We'll try that in a minute. Then to affirm, to support, to emphasise that it's your choice. You can decide. If you don't like doing exercise, that's fine. Let's find another way for you to do the stuff that I think is important, or that we've decided is going to help you move closer to the life you want to live. Let's try reflective listening, and let's summarise. So, click fingers for closed questions. Clap your hands if it's an open question. This is audience participation time. Ready? Okay. Open or closed? Quick. Yes. What does it feel like when I do this? Is it sore here? Ooh, gotcha. So that's a closed question. When is a good time for your exercise? Thank you. Are you employed? And everybody should say yes. Will you fit your exercise in after work? Oh, you guys are awesome. So open and closed questions are fairly easy to decide, but they're hard to do when you're trying to find out specific information. So just think about how you might phrase that. This is the affirmations part. So what we're trying to do here is look at this person's had a go at being willing to come to see us. And that means they've put some effort in. How can we support that movement towards what they're looking for? So here are some ways of phrasing this. Even though you're really sore today, it's great that you came in to see me. Not, oh, you had a bad day, huh? Why didn't you do your exercises? Although it's been tough and you've had a flare-up, you had a go at using that skill. So we're just trying to emphasise they had a go. We're not caring about the outcome. They're having a go. Because that's more important than the outcome. Outcomes happen after practice. That must have been difficult to say to me. I appreciate your sharing. especially when somebody says, didn't know those exercises, didn't do that thought record, didn't like it. That must have been really hard to say. People like to please. So just some ideas about how we might affirm somebody's steps towards what we're looking for. How am I going for time? Cool. Reflections. Oh, cool. Reflections. This is a beautiful part of the South Island of New Zealand, in the Mackenzie country, down near Twizel. Isn't it gorgeous? And it's just like this. We're not going to just look at pictures. Okay, so there are simple reflections and there are complex reflections, and most of us are reasonably okay at doing the simple reflections. So here's something that a person might say to us. My partner said this pain science thing is nonsense, and I don't know what to think. What would a simple reflection be? Perhaps you're puzzled about pain science. Nice simple reflection. A complex reflection reflects the content, but then makes a guess at what that might mean. Something like, and you're wondering if he's right or if you should look somewhere else. And maybe some things did make sense to you. Or, feels so frustrating to try and explain something this complex. This sounds like us, doesn't it? It would feel a lot better if you had some certainty about what's going on. So what we're trying to do in these complex reflections is take a stab in the dark at what might this person really be getting at. And in doing that, we may be wrong. It's okay to be wrong, because you can bet the person opposite you will tell you you're wrong, you got it wrong, and then they might rephrase it. Or you can ask, so if I got it wrong, can you just tell me a little bit more? Tell me more. I'm not singing. So, here's a go. In pairs this time, come up with a simple reflection and a complex reflection for the statement. Anyone heard a patient say that? Yeah. Okay, so in pairs, just think about what you might say. By the way, I really don't like exercise. If that one's a tricky one, try this one. Heard this before? And a lucky last, and I have heard people say this to me. Okay, I'm hoping that you've had a chance to try some complex reflections. So one way you might respond to, I really don't like exercise, it never does any good, would be just to parrot back, you really don't like exercise, do you? Well, hey, yeah, that's just what I said. It sounds like you're really frustrated that even though people have told you that you should be doing these exercises, it hasn't changed anything for you. You could say something about frustration, disappointment, anger, worried that I'm going to say the same thing to you. So just venturing a little further. I think I should be able to do more, but I just can't. My pain is overwhelming. Sounds like you're in a really, really hard place right now. And you're really not sure what you should be able to do and whether you're making it up. Something I've heard people tell me. And they will tell you very, very quickly if you're wrong. I tried to talk to my wife about this, but she told me it was a fancy way of saying it's in my head. And you're really worried in case it is all in your head, but yet your pain feels really real. And it is real. So they're just ways of going a little bit beyond parroting back what you've heard and making a little bit of a hypothesis about what else this might be representing. You really can't go wrong. It's not weird. And I've never heard a patient yet say, oh, they just talked too much to me. They listened for too much. Never. I've heard many, many patients say to me, just didn't understand, didn't get me, didn't even try to talk to me. So I don't think we can invest too much time in trying to understand where our patients are coming from. Lucky last. Well, not quite. Does this approach feel weird to you? No. No? Oh, that's good. Here's more wisdom from the very great, the very awesome. You know, don't fear failure. Sometimes trying these things out does feel a little bit weird. It feels unfamiliar, and we revert back into the old, you need to do this, you must do that, and here's an exercise for you. Don't let it get, even this, don't let it get set into one form. Don't just parrot my words. Have a go at your own style. I have a certain sense of humour, which unfortunately gets the better of me. Adapt it, let it grow. And we know that preparing for tomorrow is hard work today. Yeah, he's just awesome. He's just amazing. So, summarising means just pulling it all together like a bouquet. What this person is telling me, let's pull it all together to check your understanding, to reflect back some important points, the things that you've identified might be important. Sometimes to signal transition to another topic, and to highlight change talk. So I often say, so what you're saying is, on the one hand, this is good, this is where I'm at, and on the other hand, I'm here. And then I have these wonderful phrases that I use a lot, and where does that leave you? Because I'm not making the choice. This is this person's life, not mine. And it's their decision. So where does this leave you? What do you think is the next best step for you? And for some people that might be, actually, I don't want to do this. This is not the right time. But other things that are important, that's okay. We don't have to do this stuff. We can leave the door open by being prepared and willing to show that we will be there and it's okay for them to choose. You know what? People really, really respect that, because in so many situations when someone has pain, they don't have choices. And we're giving them the honour of being able to make their own decision. The other way I use summaries is when I'm stuck and I need some breathing space and I need to think. So we just summarise and let the person think about what they're saying. It's incredible. So here's a moment. How would you like to help your patients understand? Just a thought. We're not going to do this because we don't have time. So I'm going to flip past there. Wasn't that good? If you think a thing is impossible, you'll only make it impossible. Yes, it's more Bruce Lee. He's amazing. Did I say that? So sometimes this feels like it takes a lot of time. Some people just don't want to change. They're stuck. This is the way they work, and that's okay. It takes energy. You have to think hard when you're doing this. There's a change of pattern. There is also the Dunning-Kruger effect. Who's the geek? Can tell me what this is? Quick. Yeah.
The more you think you know about something, the less you likely know about it.
So in other words, we think we're better than we really are. Yeah. So people can think, well, my communication skills are just fine. Thank you very much. I don't need to improve them. So there are some ways to work through that, which I'll talk about in a second. And some of us just have a round to it. Or need a round to it. Right. Where does that leave you? What is your next best step? in terms of communicating and in terms of being the therapist you want to be. So this is a worksheet. We may not have time to go through it. I'll check with the boss. And again, there's a nice Bruce Lee quote there. If you spend too much time thinking about a thing, you'll never get it done. Make at least one definite move daily towards your goal. Now, this came from a study by physiotherapists and I think they were clinical psychologists about helping people make a change and anchoring it to an actual behaviour, so making things happen. So you can use a form like this for yourselves, that's your mission, or you can take a copy of it and try it with your clients. I'll very briefly go through this, and then in the break, have a go. Don't leave it. First of all, I will know. I have ways. You laugh, you wait there. But also, I know myself. If I don't do it now, I'll never do it. So consider this. So the next step, what is your next best step towards being the kind of clinician that you want to be? You spent a moment before saying, this is the kind of clinician I am, these are some of the things I do, this is why it's important. So now's your chance to fill in the blanks. Why is it important to be this kind of clinician? Why is it important to you? List those down with a patient and you asking whether they should do some exercise. Why would it be important for them? Get their ideas about importance. And then be real. What gets in the way? Life gets in the way. We're grown-ups. We have kids. We have bugs. I have a 19-hour flight back home. You know, there are things that make it hard. I don't have the Lycra available, so I can't exercise. Or I have the Lycra available, and that's why I can't exercise. Then, as clinicians, we work together to say, well, how can we problem solve through that? Let's write that down. So maybe that is making it so hard to not do that you'll do it. One of the things I have is a belly dance practice, and I have a commitment to doing 5 minutes of belly dance practice every day. That's teeny. That's not even worth doing. But you know what? If I do that, I invariably do more. So I set the goal ridiculously low, because otherwise the other obstacles like, oh, it's warm in bed, and I've got to have coffee first, and the dog's on the floor and she won't get out of the way, and all these things will come up and stop me. So thinking about some problem solving, and then looking at if-then plans. What this means is, if the dog's on the floor and in the way, then I'm going to give her a biscuit and chuck her outside. If the bed is nice and warm, and I don't want to get out of it, then I'm going to ask my partner to turn the heat pump on so that it's not so cold when I get out of bed. Because he gets up at 5:30 and I don't. If I think I'm going to look dumb, then there might be another solution. So we've got ways that we can anchor those thoughts and come up with ways of circumventing the obstacles that are present and also the ones that we believe are present, whether they're there or not. So my plea, my request is have a go at doing this. Use it for yourself, because our patients are people, and hopefully we are too. Thank you. Hold on. But wait, there's more. Yes. That's not Bruce Lee. Damn. I thought this was very good. And the final word does go to Bruce Lee. He's amazing. Watch a movie of his, it's great. Thank you.
Thank you.
How's my time?
Well, you did give it a little bit over, so we won't have quite as much time for questions as we would like to have. So
yes.
I would like everyone
Secret
to have
plan.
lunchtime. But we have a question way in the back here. And while the microphone's heading over there, I just want to compliment you on your choices of Bruce Lee and Jackie Chan. I've watched all their movies.
They are awesome, aren't they? They're just awesome.
Bronnie, that was brilliant, thank you.
Thank you.
Do you have any resources that you might be able to suggest for us, some good books on motivational interviewing or other resources that might be helpful for us?
Yeah, Google is your friend, and so is YouTube. Go onto YouTube and there are a heap of motivational interviewing clips. Motivationalinterviewing.org is the resource for all things motivational interviewing. There are lots of books by Miller and Rolnick, in particular Health Behaviour Change for, I think, can't remember the title of it, that's the one. It's got a gorgeous title, picture on the cover. But there are lots and lots and lots of pieces of information out on the interwebs. My blog has got some stuff on motivational interviewing. I'm not sure that I'd call it motivational interviewing, it's just more about helping us understand where a person's coming from. Motivational interviewing can be a bit more structured than the way that I've depicted it here. To me, this is just about beginning to learn to have those conversations with people and to learn to listen and be guided by where the person's at instead of imposing our ideas on top of them.
Right in the back here.
Hi, thank you very much. I have a question that might pertain to a lot of us here. I'm a massage therapist, and people come and they pay for their 60 minutes on the table. They enjoy it, they like it, it helps them. And I have a really hard time taking time away from that to have any discussion. It's fine in the initial consultation, just about, and I work in a couple of minutes here and there, but do you have any hints or tips for how we can do this in a practical setting when the people are a little resistant to that from us?
Yeah, it's a real challenge. I don't have the problem with sort of charging and billing and things, but I think that when you're doing things with people, that you're in a really close, intimate relationship, and people often talk to you. And while they're talking to you, that's a really great opportunity to just ask those open-ended questions about, I wonder what this might mean for you. I wonder what you think the next best step might be. So it's just very gentle and very subtle, and it's not, I'm going to sit down and do CBT. It's, as I'm doing my normal work, I'm just going to take a moment to, would it be all right if I sat down for a moment and found out how your week went? What was really good about this week? What wasn't so good? Is there anything we can do together that might make next week a little easier for you? So just being gentle about it. We don't need to become therapists when people have expectations, and allowing the person's readiness to guide that. Maybe all they want is a really good relaxation massage, and that's fine. Did I answer?
All right. I think we are at the end of our available time here. Yes. So thank you once again so much for your presentation.